So, quite a few patients come to me in OPD with complaints of pain in front of the knee joint, especially when doing activities like climbing up and down the stairs or sitting on the floor, what you call as a deep squatting, or when they keep the knee in the bent position for a long time, like when they go for a long drive or when they're watching a movie in a theater with a closed leg room. So many activities where they complain of pain in front of the knee. So one common reason for this is Chondromalacia patella. And now the reason why I want to talk about Chondromalacia patella is a lot of people are talking about that on social media. Many people are talking about it, including physiotherapists, gym trainers, and even sometimes patients who have recovered from Chondromalacia patella either through physiotherapy or through surgery. Even now they have become experts and they're talking about Chondromalacia patella. It's very important to know what it is. The word Chondromalacia patella describes that the lining of your patella, that is the kneecap in front of the knee joint, tends to become rough. Normally they're supposed to be very smooth, so that helps in smoother movement of the knee and helps in easy gliding of the kneecap when you bend the knee front and back. But due to some reason, the cartilage tends to become softened first and then eventually becomes worn out. So that leads to pain in front of the knee in those activities, and sometimes it leads to irritation around the knee, and also the patients can start hearing grinding sensation in front of the knee when they do such activities. The reason for this chondromalacia is very complex. It's not as simple as it being described on social media. It could be varying from a simple reason like an overuse of the knee to gross muscle imbalance. Muscle imbalance means, see, if you look at this model, if you see this kneecap is attached to this stronger muscle, what we call as a quadriceps muscle, and even the hamstrings muscles comes from behind the knee. Even the glutes muscles influence the knee, the way the knee moves, the strength of the knee, and the coordination of the leg and the knee when they do activities. So muscle imbalance can also be one of the major reasons. But one reason what it is less talked about on social media is the anatomical factors, the bony factors. Because if you look at it, the patella moves around this trochlea. This is the the bone of the femur. It has a concave configuration, this is a convex configuration. So this perfect configuration is very important. But in a lot of people there will be many anatomical variations, like instead of a straight attachment of the patella, there could be a side attachment. So that shifts the patella to the corner. And in some people this concave trochlea could be a shallow one, so which makes the patella difficult for the patella to stay on that. And sometimes there is what you call the patella alta. That means instead of at the right position, it could be at a higher position. So now all these factors are by birth, actually what you call as bony factors. They are not developed over a period of time. Muscle problem develops over a period of time, overuse develops over a period of time, but not the bony factors. They are by birth. So it's very important to even evaluate the patient for those bony factors, because the word chondromalacia means they always think that okay, muscle imbalance and overuse, so we'll put them on physiotherapy. Yes, so that's the right treatment. We always start with the physiotherapy, and most of the Chondromalacia patella responds very well to physiotherapy. They don't need anything else apart from that. Correct the muscle imbalance, correct the muscle, the incoordination, what it is, and the way they're doing activities, all these things. But sometimes when they don't get relief out of it, it's very important to evaluate these bony factors. And without that, the cartilage damage tends to progress, and if left untreated can lead to disastrous consequences. The gross arthritis, the arthritis can spread to all over the knee at a very young age. So it's very important to understand the underlying cause of Chondromalacia patella. If it is diagnosed properly and evaluated properly at the right time, it can be treated perfectly and in a proper way, and patients can eventually return back to complete normal active lifestyle. So if you're having pain in front of the knee in doing activities like climbing up and down the stairs, deep squats, and sometimes even yoga teachers also experience this Chondromalacia patella, and all these activities, if you're having this grinding sensation and pain in front of the knee, it's important to get it evaluated.